Hi there, I'm Dr. Andrea Schnowske, and today we are talking about the delayed sensitivity food allergy testing that we offer in our office. So, a lot of times when patients are coming in, they have all sorts of issues with digestive issues. They're noticing they're having heartburn or reflux or GERD, or maybe they have issues where they're belching very frequently or having gas or bloating, or they're noticing they have IBS symptoms, or they're getting diarrhea or chronic constipation due to inflammation. And in many cases, it can be very confusing because once your body starts having some allergy response, what tends to happen is we have cross reaction. So when you're exposed to something and you're reacting to it, a lot of times there are other proteins that are similar to it that when you introduce those, you start reacting to those too because your inflammation level's going up, and we get into this cycle where you don't know what to eat. You're constantly having pain or belching or symptoms, and you have no idea what's causing it. It may be right after you eat, it may be a couple days later. And here's the thing, delayed allergy sensitivities to foods and things like that and additives in our food actually tend to show up hours up to 3 days later. So it can be very confusing, and it can be very hopeless because a lot of times you don't know what to eat that's going to be safe, that you're not going to react to. You try to eat bland foods and you're reacting to those too. So what do? We have a delayed sensitivity testing in our office. It's called the FIT test, the food inflammation test. And what's really great about this test is we have two different levels. We have testing where we test for 22 different foods you're reacting to. And I've got a little list here of the foods that we see with this. So this is our lesser test. This test for, I'll read these to you, test for any reactions to almonds, bananas, beef, brewer's yeast, which is you're going to find in salad dressings and vinegars. You may find those in also beer products and even wine sometimes. A lot of times I add it even for flavoring in foods and coloring in foods too. But we also test for broccoli, candida, which is a yeast, casein, which is a protein inside of your milk, chicken, coffee, corn, cow's milk, egg whites, egg yolks, gluten, peanuts, pineapple, salmon, shrimp, tomatoes, turmeric, white potato, and whole wheat. Now that's our lower level testing that kind of gives us an idea with some of the most common things that we see reactions to in our office if you're reacting to those. The only drawback with that is if you are reacting to, say, cow's milk, you don't necessarily know if you're going to react to goat's milk, or if you have an allergy to almonds, you don't necessarily know if you're going to react to maybe cashew milk or something like that. So what I find is really great is since we have two levels of testing, our next level test literally gives you a graph. This shows you a graph of all these different foods, what you're reacting to, how severe the reaction is, so that we can come up with information, not only what you're reacting to and how severe, but how long we want to avoid that to reduce that allergy response so we can get rid of allergies. And we're able to come up with a plan to reduce inflammation so we can get rid of those allergies. But the great news is we know what you're not reacting to. So we can figure out what you can eat safely without causing symptoms, without aggravating things, so we can get you answers and come up with a plan to get you better and stay better. Because ultimately, our bodies need to know number one, they need the right things to heal, but we need to know how to heal our bodies. So in order to do that, you need information. So in our office, we focus on education. We educate you on how inflammation works. We educate you on how allergies work, how your immune system works, and also other things you can be doing outside of the lab testing to help reduce inflammation in your bodies, whether that is dietary changes or if you have an injury or chronic pain, there may be other things we need to look into as well. So give our office a call, 309-689-6200. We are located in the Metro Center. We do accept insurance, but a lot of these tests sometimes are not covered by insurance. So we also offer not only cash discounts, but we also do payment plans through our office as well as through Care Credit. So if you want to get to the bottom of what's going on with your health, give us a call. I promise you, you're going to learn so much, and you're going to understand about what to do or what to do to take that next step to get into the path of healing. So give our office a call, 309-689-6200, or stop it in the Metro Center. Have a great day.